Hola, muchas gracias por estar aquí a todos. Bienvenidos. Gracias por estar aquí en nuestro entrenamiento de cómo fomentar la confianza en la vacuna del COVID-19, al igual ayudarnos a las personas a tomar mejores decisiones informadas. Muchos de nosotros quizás estemos aquí porque queremos ser influenciadores, muchos de nosotros quizás estamos aquí porque solamente queremos agarrar esa información, educarnos un poco a nosotros mismos y a nuestras comunidades, al igual que nuestras familias. So, muchas gracias. También a este momento me gustaría agradecerle muchos a nuestros colaboradores, que sería el Condado de Sacramento de Salud Pública, a la familia Counseling Center, Kaiser Permanente y SACLab, Sierra Health Foundation también. Mi nombre es Adriana Sánchez, aquí voy a estar, estamos aquí representando, trabajando con Sierra Health, SACLab, vamos a continuar un poquito ahora con todo. También me gustaría darle la bienvenida a Dr. Bermúdez, que está aquí presente, al igual que Vanessa Martínez. Vamos a tener algunos otros colaboradores aquí ayudándonos durante la presentación para si tienen preguntas. Ahorita voy a pasar a la siguiente
Have
presentación.
questions. So now I'm going to go to the next page. So here, just a few things before we begin. Please remember that all of the lines are going to be automatically mute. So for those who have questions, or if you want to maybe make a comment, you will have to click on the link that appears below, and you can make your questions there. I would like to remind you that we are going to just take the first three questions, or the ones that the top questions, to respond, to give Dr. Bermudez the opportunity to respond to those. For those persons who would like to listen to this in English, there is a button, and that you can click, and you'll be able to listen to the interpretation, the English interpretation. So now, if there is a question, if if there's a consent, or if you have a question, please, you can send an email to Vanessa Martinez. Her email, you can actually see it is mmartinez, or Sacramento .ro. You can actually see it, and we're also this workshop is being recorded and is also going to be available in the Sacramento County's website. And you can also find them there to the County of San Mateo. If you want more information, you will be able to find it there. So we're going to talk about why we're here. What is the objective, or what, as I explained, a lot of us are here to obtain more information about what is COVID-19, and also the updates, the latest updates about the vaccine. And we also want to obtain more information. And also we want to be able to give the key messages that have to do with the concerns that people have, especially in our Latin community. We want to give you the tools, the communication tools, so that you can have those effective conversations. And also, finally, we're going to show you how to change the dialogue, the conversation about COVID-19, to have one that actually people want to have now. So we're going to start. So why are we here? Because as we look at the data for the county, many in our Latino community, they're being impacted. So this is very important to offer this kind of trainings, so we can have the opportunity to go to our communities and to share what we're learning here, to, to share it with our communities, with our families, with our friends, with everyone, because we know that sometimes because we do listen to each other, and if we can offer the training and offer the information, we can actually educate our communities and clear their doubts about the COVID-19 and the vaccine. And we can also become actually, we can also help to promote vaccination in our community. And finally, we are going to take care of each other and we're going to empower each other with this training. Well, and this is what's going to happen today because thank you very much, everyone, for being here. And we're going to talk about the following topics. Everything that's related to COVID-19 cases, deaths, and vaccination rates, updates about the vaccines, and how to communicate effectively about the vaccines, and what would be the next steps that we must take. Again, why are we here? Because we want to promote the vaccination and we can help our communities to build trust. And we can also gain knowledge about the data and we can also get the tools so that we are able to have these conversations. We can also start building trust in the resources that are necessary and to clear anything that has to do, everything that has to do with the vaccine. And as I say, it's to have that trust in the safety of the vaccine and also to have the information about what we want to share with our communities, which is all this information about the vaccines. And then later we're going to switch and we will talk about the doubts. What are the doubts? What are their fears that we need to talk about as friends, as part of a community? Also, the data about COVID-19, we're going to talk about the cases, deaths, and a little bit about the vaccination rates. And as we can see here in Sacramento County to date, there are 608,177 cases and deaths in Sacramento County. Today, we can see that is, I'm sorry, it is, and there are cases in the county of San Mateo, and this actually, it was in the last few weeks. I would also like to talk about the subject that 99% of the COVID-19 cases that we are actually seeing are happening even among the people who have not been vaccinated in Sacramento County. So in the week from the 14th to the 20th of June, the rate actually is the 99% is actually those who were not vaccinated. So 20.7 per 100,000. It is the increase in the rate of cases, and because most of the cases actually happen in people who were not vaccinated, and we need to have this information so we can share with our community so they will get vaccinated. And here, as we can see, this is the rate per 100,000. And a lot of people of color are actually impacted. And we can see here in 5,000 persons, especially in the Hispanics, they're the ones who are being affected in the number of cases. But if we have this information, I feel that this is it's going to give us the opportunity to share this data and share the information that we're learning today, and we'll be able to educate our communities. So now we're going to see who is getting the vaccine. As we can see here, these are the numbers of the people who are yet being vaccinated. 62%, that's the rate of the people who have been fully vaccinated. And it's 68,127 doses per day are being administered. And Sacramento County, these are the vaccines that were given, which is 1,568,608, which is 48.6%. This is good, but we need to actually increase these numbers, especially in our communities. And now I would like to give Dr. Bermudez the chance to address everyone. And he has a lot of information to educate us. So thank you very much. I feel as a car who wants to run. Thank you, Adriana, for being here with us. And thank you to all of you for being here. I don't know if you before have listened to me, but I'm really passionate about education and about giving people the necessary tools so that we can all get vaccinated, like to our cousins, grandparents, all of our relatives. Actually, they're dying because they were not vaccinated. So what I wanted to do today is to talk actually about there are three sections. First, we're going to talk about what is the virus, the COVID-19 virus, and then what are the symptoms. And after that, we're also going to respond to, we'll take questions, and will be the top three questions. And then the second part will be about the vaccines and the efficacy. And the last section will be how we can communicate effectively about the vaccination. So Adriana, could you please show the next slide? I don't know if you were alive in this during these times, but I was. So I remember about smallpox. It's the same movie, but the same subject. Well, yeah, because smallpox it was like wiped out. It was disappeared because we started vaccinating people. That's what we want. We want to wipe out COVID-19. That's why we're here. The next slide, please. Thank you. So what is COVID-19? We know that it's a contagious respiratory illness. Coronavirus is a huge family of viruses that cause colds and other respiratory illnesses. But we know that there's no cure, but there is prevention. Please pay attention. Experts belief that it's transmitted from person to person through droplets in the air when an infected person coughs, sneezes, or speaks. And probably most of the transmission it's through people who do not have symptoms, which are asymptomatic or pre-symptomatic. So that means that even if they feel okay, maybe they are infected. That's the problem, because COVID affects people in different ways depending on the immunological system. So some get really bad symptoms, even death. So it could be from mild to very serious. Next slide. This is the Delta variant. When we started, it was called Alpha, but now it is Delta. So what is it that you need to know about this? Delta is more contagious than the others viruses. And it also propagates faster than the other viruses. So Delta could also actually cause hyper, like for example, places where maybe it's a stadium or it's a church or maybe even the city, it can actually really spread. So we need to learn a lot more about Delta, and vaccination is the best protection against Delta, because people think, oh, well, I won't go to church, I'll wash my hands. Well, that's good, but actually the true protection is the vaccine. Next slide. So what are the symptoms of COVID-19? Well, chills, fever, cough. Uh, um, People lose the sense of smell and taste. So they get a sore throat, muscle pains or body aches, diarrhea, maybe nasal congestion or secretion, nausea, um, vomiting, shortness of breath, or difficulty breathing. And one can get infected without having any symptom. Yes, yes. So how can we? Oh no, the next slide, please. Okay. So how can we prevent getting infected? Well, we know that we can wear a mask. Also, the social distance, 6 feet. Also, spend time outdoors, and also increase the ventilation at home. Also, washing hands, and also disinfecting and disinfecting and disinfecting. Next slide. Okay, we're going to stop here because I guess maybe I spoke too fast. Maybe you have questions about what is the virus? What do you think is the virus, and what do you think? What are the symptoms? Well, but I guess our participants do not want to ask us questions, but if you have any doubt, please ask us because the doctor is here to respond to your questions. Well, before we continue to the next slide, I wanted to tell you that if we don't get vaccinated, this virus is going to actually spread more, and there will be more varieties. But doctor, they're asking us if there are different symptoms between COVID and the Delta variant. No, there's no difference because it's like a cold, it's like a flu, and the symptoms are similar. But this virus, the Delta virus, is more contagious because it goes from one person to the other, but the symptoms are the same. We have another very interesting question, and is it possible? Would the vaccine actually be useful? Well, that maybe the vaccine doesn't work and they still get infected. If we're going to talk about the efficacy, all vaccines are different. But even if one is vaccinated, it's possible to still get infected. We're going to talk about more about later. But it seems that you have already responded this question. Is that the Delta variant? It affects faster and it's more serious. Yes, because the mortality is almost the same, because we have learned a lot about it, about how to treat it and how to support people who catch this virus. And there's no effective treatment to there's no medication to kill the vaccine. All the medications that I use are just to support the body, but the body has to respond. That's what's important to get vaccinated. Good. Very good questions. Okay, so which are the vaccines that are available and what is their efficacy? There are 3 vaccines that have been approved. 2 of them, Pfizer and Moderna, they're the ones that are RNMA, or messenger RNA. Those are the vaccines that are very effective. Pfizer is a vaccine that it consists of 2 doses. It's the only vaccine that's being approved for children, 12-year-old children, all the way to adult. Moderna, there are also 2 doses, but it's from 18 years of age and up. Johnson & Johnson is just 1 dose from 18 years and up. And Pfizer, the second dose, we recommend to get it 3 weeks later, and Moderna it's 4 weeks after the first dose. but it's effective even if it's done between 4 or 5 weeks. Johnson & Johnson is just one dose, and it's effective up to 2 weeks. There are other vaccines that are actually being that are in the process of approval, but they have not been approved here in the United States. AstraZeneca and Novartis. The next slide. Very good. All of the vaccines that are approved, they're safe and they're effective. That's what I want everyone to know, that but the vaccines are safe and they are effective. And CDC and FDA, they will continue monitoring the safety of all of the vaccines. And we are learning more about what are the side effects. Next slide. It seems that there's a confusion. This is kind of confusing. This slide is confusing because it has not been translated into Spanish. First of all, the Moderna and Pfizer vaccine it's called messenger RNA, and the way that it works, because it uses a genetic inactive virus genetic code, and it tells the cells how to build and code it in a lipid, and those are spikes. That's what they call it. In Spanish, it's called like corona because of those. But the cells are the ones that they produce the protein, and the antibodies. Then the immune system is the one who creates those proteins in those cells. And what happens is that the antibodies then are released. So the antibodies are already there, but if one gets infected, they recognize the virus. So then there's actually a fight, and the antibodies, they actually kill the virus. But this virus is a new virus. It never existed since the world was created. So our bodies have not actually built that type of immunity until now. The next slide. The Johnson & Johnson vaccine is similar, but that one uses like the RNA vaccine, and similar to the ARNM, it also helps the cells produce that protein, but it uses ADN instead of ARN. But it causes a response of the immune system to block the virus from. But the difference is that this one utilizes or uses ADN and the other one ARN. Next slide. So you've already heard that Johnson & Johnson now it's available after it was actually in a pause after because there was information about blood clots. There were like 15 patients, but after 8 million of people who were vaccinated, they presented this condition that was very strange, and it happened in women 50 years old and under. But it was very strange, those blood clots. But now we are alert, and it was like 2 cases in a million. It's very strange, but it doesn't happen actually frequently. But for women less than 50 years old, it could cause that. But all of us doctors, we're ready, and we know what we can do if that were to happen. Thank you. Next slide. Now, this slide, it has a lot of information, but I want you to think and to look at this slide. Pfizer, 2 doses, Moderna, 2 doses, Johnson & Johnson, just 1. These are the studies and the participants. For Kaiser, there were more than 43,000 participants in the trials here in the United States. This was before the variants that now we're seeing, because the vaccine was created for the alpha virus, so now there are other variants. and it's 95% effective. And what we have also found out is that it's very effective for the Delta, and it helps so the people won't go to the hospital and also to prevent death. Moderna, that is also 2 doses. There were more than 28,000 participants before the variants, and it's 94.1% effective and 100% protection. But so this is important. If they get the vaccine, they won't die. Now, Johnson and Johnson, that one had 40,000 participants. It's an international vaccine that including Brazil, where there were already variants, and it's 66.3% effective, and it's 85% against the very serious or critical COVID-19 illness. If you don't want to die, well, these vaccines help. But we want to say about Johnson & Johnson, there is just 1 dose, and it's very effective. Although 66% is not really a lot, but if we compare with the flu shot, with the vaccine that we get every year, it's like 50 or 55% of efficacy. So 66.3% is still good, and it's just 1 dose. The next slide. Here, they're telling us how is the efficacy when we compare different races. So here we're talking about the Caucasian people, white, the blue column, dark blue, that's 74% of the population who got vaccinated. When we compare to 12% that were Afro-Americans, 10% Asians, and 10% Native Americans. And the light blue is Pfizer, the orange is Moderna, and the yellow one is Johnson & Johnson. And here it tells us that 82% of white people, they got Pfizer, and you can see that all of the people, they got this vaccination, but comparing to the information on the right side, it has to do with ethnicity, which is Latinx or non-Hispanics, and it says that 82% of people who participated in the trials, they belong to that ethnic group. So 20% they got Moderna and 45% Johnson & Johnson. The reason why we share this slide is so that you can see that the participants were very diverse. Everybody participated in those trials. Next slide. Now, what are the benefits of getting the vaccine? If we see on the right side, the people who are fully vaccinated, and then on the left side, those who are unvaccinated, we see the green, which means that it happened. Yellow is like an alert, and red is like didn't pass. So if you see look at the activity that we'd see outside of the home, let's focus on the red now. We don't recommend for you to go to a crowded place for maybe a basketball game without wearing a mask, especially if you're not vaccinated. And even if you're vaccinated, wear a vaccine, because you could still actually catch the virus. So what we're losing is a lot of things that we can do. We're missing a lot of things that we can do if we're unvaccinated. That's what this slide shows us. And also what we see is that the red, if they're unvaccinated, we don't want them to go to the movie theater. We don't want them to go to church. Well, we want them to go to church, but only if they're vaccinated, because not to go to a restaurant. So we're missing a lot of things that we probably want to do, because that will expose expose people to the risk of getting infected. Next slide. So the benefits of getting the vaccine. There are three vaccines that are approved in the United States: Pfizer, Moderna, and Johnson and Johnson. And there are others that are in the approval process. All of them have gone through very strict safety processes. They can all prevent. They're very effective in preventing the COVID-19 sickness. The three of them, they produce antibodies, and they offer us a long-term protection. But and there also there's been a lot of studies that actually analyze the effectiveness of the three vaccines against the variants. And it also helps with the alpha and also with delta. So we want you to know that they are effective. Now, the vaccines that require 2 doses is very important to get both doses, because what's happening is some people get just 1 dose, but they don't get the second one. But we want you to get both. Next slide. And well, you're not going to be charged because all the vaccines are free, and have been available for more than 12 years for Pfizer, 18 years for Moderna and Johnson and Johnson. So there are children who are going to school from 2 years and up who have Pfizer from 12 years. And we're also right now, they're conducting studies for children from 2 months up to 12 years old. Pfizer and Moderna are, maybe by the end of this year, we're going to have the approval so we can vaccinate small children. And here it says more than, it's a billion of people in the worldwide have been vaccinated. How many billion in the world? That's a very good question. Like 7 billion or more. So it's just 1/7 of the population of the world has been vaccinated, but we need to vaccinate everyone. The hope is that the vaccines will able to end the pandemic. And if we get vaccinated in the United States, we're going to have more freedom. Being vaccinated, it's a personal choice. There are people who don't want to get the vaccine, maybe people who have medical conditions and maybe don't want to get it, but we have the resources to help those people. All right, so how are we doing? Questions? Yes, we do have a lot of questions. I thought so. So what's the question, Maria? We have a very interesting question. If someone got the vaccine, the dose here in the United States of, for example, maybe the Moderna vaccine or any other, and returns to Mexico and cannot find that vaccine, what should he or she do? What will be the follow-up? Very good question. Obviously, what we want is for everybody to get the second dose here in the United States. But it's possible that they could get the second dose of the Moderna, but don't switch from Moderna to Pfizer or to Johnson and Johnson. But we say 3 or 4 weeks, but one can wait 6 or 7 weeks. But come and get the vaccine here. That's what I would recommend. If you cannot get it, you would have to consult with your doctor to find out what is the most updated information. Because if you got a vaccine 6 months ago and you can't get the second one, speak with your doctor so he can help you make a plan. But if you get the Moderna here, then get the Moderna there too. Don't switch vaccines. Okay, you already answered the question, but also they say how long if one got the first dose during the waiting period for the second one, what happens during that period, it got tested and it was positive. That's a very good question. And how long should he or she wait? When one gets the vaccine, especially Pfizer, Moderna, or Johnson and Johnson, the immune system, it takes the immune system 2 weeks to actually get the immunity, because even with Pfizer, but there's like a 50%, but in those 2 or 3 weeks, actually one can still get infected. See? So when they get the second dose of Pfizer or Moderna, then the immunity lasts, it takes 2 more weeks. So it's like there are 6 weeks to actually be able to get full immunity. That's the problem that we're seeing, that some people can get infected. And that's important to know. It's important to know. Now, if you got the virus, what we recommend is 2 weeks after after the symptoms go away, the fever, to get the vaccine. And that will give you a long-term immunity, at least 2 weeks after you don't have any more symptoms. Thank you very much. I want to remind everyone that doctor has already responded to 3 questions. And at the end of the presentation, we're going to respond to more questions. The next question is very important. Due to the issues that the Johnson and Johnson vaccine has, there's been problems with, how can we speak, how can we talk to people so that they are able to have confidence in this vaccine again? That's a very good question, because obviously we're learning about the vaccines. First of all, doctors and people, all those of us who in medical science, we're learning about the side effects of these vaccines, especially Johnson and Johnson. What we have learned is that they're very rare cases that of women who have trouble in clotting, but that we know that between 16 or 18 years of age to 50, those are the clots, but we don't know if the hormones, estrogen, progesterone, and that's why we're telling people who are between 18 and 50 years old, if they want to get it, there's no problem. It's actually rare. It's just 2 persons from a million, but there is a risk. So we do have to monitor those people. So I would recommend that if you have that kind of problem, maybe people who have suffer from clots in your feet, legs, or lungs, it's best not to get that vaccine, but get Pfizer or Moderna. But we're actually vaccinating people with the Johnson and Johnson again, but it's important to educate people. Okay, we're going to talk about that in it will be our next topic. Okay, so let's continue. So how can we communicate in an effective way about the vaccines? First of all, we have to review that there are some of the main reasons why people don't want to get vaccinated in our community. And this is one of the questions that Maria, you actually raised. And as a doctor, I want everybody to get vaccinated. Next slide, we're going to talk about the myths, and we're going to talk about the truth. There are 5 main reasons that people tell me, doctor, I do not want to get vaccinated because they think that maybe they have not tested them enough time. So it's like, oh, doctor, I want to wait to see what happens, because I'm also worried about side effects, as Maria's question. And we're afraid of actually getting the virus if we get vaccinated. We're worried, especially young people who want to have children, want to get pregnant, or who are breastfeeding, that maybe they can have problems, they can get infertility. And we're worried because about the ingredients, that maybe they're dangerous ingredients in the vaccine. That's what they tell me, but that's the myth. That's the myth. Exactly. So the first concern is the vaccine has not been tested long enough. But COVID-19 vaccine actually it was produced. It's using a technique that has existed for more than 20 years, and there were no steps that actually were omitted. We did it fast because we was during the pandemic, but no steps were skipped. The next slide. And also another concern that they're like worried for side effects. We're going to talk about the side effects. What's the truth? The facts. Yeah, it's possible that some people may that may have side effects, but that means that actually our body is actually building protection. So when if you get a shot in your arm, well, it's gonna hurt. I got it and it hurt and it was a little red and swollen, but 1 or 2 days later it went away. But I know that some of my patients is like when they get the vaccine, it's like, well, none of my sibling, oh, what some of my siblings, well, they were tired, well, they had body aches, they had chills, were nauseous. But then for in a few days, it just went away. But I would rather have those symptoms, but not getting the virus. So because it's only for 1 or 2 days and then they they go away. This has to do with Maria's question, and it's happened due to the issues with Johnson and Johnson. For example, one of my patients got that vaccine, and then they call me and they tell me, "Oh, I feel bad. I have a headache, or my leg is swollen." And well, maybe what I would say, okay, let's do a testing. But we are already working on that, and we're vaccinating a lot of people here in Sacramento. So I have not seen this issue, this of the clots here. It's very rare. Next slide. Well, also, yeah, they have the fear of actually catching the virus through the vaccine, getting the virus through the vaccine. But none of the vaccines actually contains the live virus. So it's not possible to get the virus with that vaccine. We're not giving anyone a vaccine with the living virus. The vaccine will help protect against COVID-19, teaching your body how to produce an antibody to actually fight COVID-19. Because let's remember, this didn't never happened before. So now our body has to learn how to build those antibodies. So our body knows how to fight it. And this is how we win and the virus loses. In other words, if we are vaccinated, we are protected. Next slide. Also, lately, I know that there's different generations have different opinions or attitudes, and I like to watch the news, like as a baby boomer, but my son never watches TV. He's always just using his phone and social media. So there are different ways that people get information, but and there's a lot sometimes of information in social media, but they're lies and they cause panic. And they create confusion. And one of those is that the vaccine causes infertility. Not at all. The truth is, this this is these statements are false. That if one gets the COVID vaccine, one is not going to have children. That's not true, because all these have already been studied by fertility experts, and there's no data that actually support that the vaccines have an impact in fertility. So for those people, who actually want to go through fertility treatment or want to get pregnant, it's better for them to get the vaccine. So what if they get pregnant and then they get the virus? That would be much worse. Could be much worse. Next slide. If they're breastfeeding, that's also very important. That's something else that's not true, because they the idea that the vaccines produce risk to the infant, it's very, very, very it's not actually possible that it could have an impact in the baby who's being breastfed. For example, if a woman is vaccinated and is breastfeeding, the antibodies actually can go from the mother to the baby, and that actually gives protection to the babies. That's why we want, when the women get pregnant, that's what they tell them: breastfeed the baby, because it actually helps them, because you're giving actually protection to the baby. And also it actually prevents developing breast cancer. So the best thing is, if you actually qualify, is to get the vaccine. So we actually recommend the women who want to have children, who are breastfeeding, actually to get the vaccine. But if they have doubts or concerns, to speak with their doctors. Then this is the concern number 5, that there are dangerous ingredients in the COVID-19 vaccine. As I said, there's not live virus in the vaccines, because a list of ingredients, none of them is actually a toxic ingredient. It's like water, sugar, a little bit of salt, and a little bit of alcohol. That's all it is, because that's what actually helps preserve the ingredient. So, but there's nothing toxic. And the main vaccines have already been tested during many months in thousands of people. But remember that COVID has actually killed 500,000 of Americans and more than 1.6 million worldwide. So when they gave me the opportunity to get the vaccine, I was ready with my arm right there, because I had already done research, and I would rather feel a little bit not feel well for 1 or 2 days than actually getting the virus. And I'm Latino, and actually I did not want to get sick. So that's why I recommend to all of you to get the vaccine. Next slide. Let's talk about how to have these very difficult conversations. But we're going to give you some tools. Next slide. There are 3 questions that I actually ask my patients. The first one, I start with, and I ask and then I listen, and then I try to give confidence to the patients. And the next thing that I do, I try to find tools of a common ground to do it. For example, I start asking them, what is your opinion of the vaccine? And when they respond, I'm like, why? Why do you feel like that? And what worries you about the vaccine? And I listen to them. And what and to be able to build trust, I say, oh, I would also be afraid if I really don't understand what the vaccine is. But why don't we explain it to you what it is, so that you can feel safe? Because what we want is, we want you to feel safe. And that's what actually worries me about what could happen to you. And actually I did have this conversation with my children, with my family, because my children didn't want to get a vaccine, because they also had this fear of, but we try to find common objectives, because we all want our kids to return to school. We also want our loved ones to feel safe. My parents, who live in the Imperial Valley in Calexico, they're 88 years old. I had not, before they got the vaccine, I had not seen them before I got the vaccine, also, I couldn't see them because it's important. We have lost a lot of time. And another question is like, what would motivate you to get the vaccine? Because when they find the reason to motivate, the motivation, that's when we can help them so that they get vaccinated. Next slide. Okay, this one was not actually translated, and maybe you can help me. Okay, let's say this. On the left side, it says what we should say, and the next side is what we shouldn't say. So on the left says vaccination. Don't say injection or shot. On the left column, it says the vaccine is safe and effective. On the right side, it says that vaccine developed quickly. Don't say that. On the left side, it says authorized by FDA based on clinical testing. Don't say approved by FDA, but it was Operation Warp Speed or just emergency use authorization. On the left side, it says, say, get the latest information. Don't say, there are things that we still don't know. On the left side, it says, keep your family safe. Keep those vulnerable safe. Don't say, keep your country safe. On the left side, it says, it's something like it's public health. Don't say government, because on the left side, that you should say it's like it's health and medical experts and doctors. It has been approved by them. Don't say it's scientists. And another one is it's okay if the people have questions, and say that, because the more questions they have, that's a way that maybe they can build trust. Don't tell people who are hesitant that they are anti-vaccine, because you will be actually losing the battle. Okay, because I will. Okay, so, oh, okay. So Adriana, another slide. Thank you. So there are 5 key messages. First of all, that vaccine will keep you safe. As we said before, the vaccine will protect them from getting seriously ill, because more than 150 million North Americans have been vaccinated, and in a safe way, and now they're protected. The side effects are frequent, but that's actually what that says is that your body is actually becoming active to protect it, and the vaccines are effective, and we'll be able to do things that we miss and that we enjoy. And people could actually, they could get a mild case of COVID-19. Next slide. And this vaccine actually had 20 years of it's based on 20 years of research and sciences. But is we have to, obviously we have to be careful when there's something new like that. But the health experts, they actually they took all of the necessary measures to produce a safe vaccine. And I actually read the articles before I got the vaccine, because I was nervous like everyone else. But now I usually tell them, this is safe, but do you have questions? And I go, I'm happy that you want to actually learn more, because at the end, the decision is yours. And I'm saying, if you have questions, speak with your doctor. And actually, you can give them information about the resources regarding the situation. Okay, and this is after the conversation. After you had the conversation, you have to build trust. First of all, you have to accept that it is their decision is actually a personal choice. Because I spoke with some patients today, and I told them what was happening, and I sent them off to get the vaccine. Okay, so you want to get vaccinated today, but at the end, it is their choice. But if my patients had said no, okay, I will say let's just wait, and I would just wait until maybe they change their opinion. I'm here as a resource to help them. That's what we need to do. And keep the communication open so you can build the trust. Trust is a journey, but give people the opportunity to communicate with you while they are actually making a decision. Everything takes time. Offer, offer your, no, offer yourself to offer to find a vaccine. Oh, help them make the appointment. And there's a website that's called My Turn that gov, ca.gov, and they can actually find a place where they can get it for free, when they can get the vaccine for free. They won't, so they won't get charged. I know that we're actually talking about a lot of things today, but it's okay to say I don't know. It's one of my favorite phrases. I don't know. But what it does, this actually builds trust, because we don't know it all. It's not that you personally don't know, but it's just that the data maybe it's not still available, because there's a lot of questions about what are the side effects. But we are working on all of these, and if we there's a lot of information. If we don't have the answer to a question, we have to try to always get updated with the information so that we can share it. And when we say that, what happens is that actually it builds trust, because if you don't know and you can say, okay, I'm going to call you later, but if you don't do it, then, but if you say that you're going to do something, you have to follow up. That's what's more important. And finally, this is actually what vaccines do. They offer hope, because what we hope is that vaccines will end the pandemic, because in the countries with the highest rates of vaccination, we have seen fewer hospitalizations and deaths. And also the vaccination helps to prevent the transmission. And also we need to have a high percentage of vaccinated people, so that we can actually get to have a community that it has immunity. Because when although getting vaccinated, it's a personal choice. And if somebody actually rejects the vaccination, that it's important that they know that they're not going to lose their jobs, because that our job is to actually be respectful of their decision, of their choice, and they should actually continue practicing social distance, the washing their hands, the masks. And if they change their opinion, they actually should get the vaccine. I think I've actually talked for a long time today. But our participants, they're asking a lot of questions. Thank you, everyone. But I do want to remind everybody that somebody raised his or her hand, they should they should click on the Q&A. The next question, doctor, if the vaccines are safe, why haven't they been why are people still afraid to get them? They have been approved. If I heard the question correctly, if the vaccines are safe, why haven't they been approved? But remember that FDA and the CDC, they all have, they need, there's a period where when people get the vaccine, and then they have to follow these patients. So what we're hearing is that it's going until the end of September, when the FDA is going to approve these vaccines, because we're still actually monitoring the people who are getting these vaccines. So it takes time, but soon there will be approved. And right now they're authorized and then approved by the FDA. because we're actually studying all of the side effects, but they are safe and they are effective. They will be approved, but a lot of people are actually going to come to actually get the vaccine here when they're approved. Very good questions that the participants are asking. The next question is, some people are actually getting high blood pressure after the vaccine. How safe it is maybe to have that side effect for a long period of time? Yeah, we have heard that it's possible that maybe there's no correlation. Some patients say that when they got the vaccine, that maybe they got high blood pressure, but we have not seen a lot of cases like that because maybe it's something else. It's maybe could have another side effects, maybe problems with the sugar, blood level, anemia, thyroid, because maybe it's because there is actually another problem that it wasn't due to the vaccine. Because when we get the vaccine, our actually immune system, our we actually we get nervous and maybe we get high blood pressure, but that's something that it just it doesn't stay forever. Another question, very interesting question, is how dangerous is the Delta virus for children who are unvaccinated? And if you know where did COVID-19 actually originate? Very good questions. First of all, obviously the virus, the COVID-19 virus, we don't know where it came from. There's a lot of confusion and they're still investigating. Some say that it came from China, and then China says that that's not the case. But there's no conclusion yet. But we know that that virus it was from an animal, that from an animal to a human being. That's new because we had not seen this before. But they're still investigating, so I wouldn't be able to tell, right? But we know that the Delta virus actually also affects children, especially the under, although the children who are not vaccinated. So get Pfizer if you're 12 years and up, and it also affects them because they have never had that type of immunity, and like any other person, they could have other conditions, medical conditions. But when it becomes available, I recommend they get it. Remember the first slide about smallpox. Remember, the only way to end this pandemic is for all of us to get vaccinated. More questions? Yes, regarding the how dangerous is the Delta vaccine for the children, unvaccinated children? Exactly. Also, and answering the same question, how dangerous it's dangerous. Alpha and Delta are dangerous virus for children, but as it is for any other person. But what is dangerous is that it gets transmitted faster from from child to child. So if they're going to go to school, your children are going to go to school, please send them with masks, more than one mask. Teach them to wear the mask and to follow all the rules that they get that they get at the school, because that's what worry us, that when they go back to school, that they can actually carry the virus and also carry it back home. So it's dangerous. The alpha and delta, it's also dangerous for children. Both are dangerous. Doctor, our next question says, what happens with the efficacy of the other vaccines like the Sinovac? That one we're not using here in the United States, so I really can't give you a lot of information about it. There's some vaccines and that we don't have a lot of information about, like Seneca, and there's a percentage that say that they're not as effective as Pfizer and Moderna. But I don't have that type of information. But I do have information that is available here in the United States that this vaccine is as effective And you can see, because there are people who are coming from other countries. They fly here to the United States from Mexico, from China, from Canada. They come here and they stay with their relatives and they get the vaccine. Excuse me? Have you heard, you've heard about that, right? There are people who are coming to the United States from other countries and they stay with their relatives to get the vaccine. You've heard about that. That's why we know that here in the United States, we have the privilege to live in this country and where we have the best vaccines available. Yes, of course. Well, thank you very much, Dr. Bermudez, and thank you, Maria, for helping us with the questions. The questions were very interesting because they're really subjects that we needed to actually talk about. And we are going to get a 10-minute break and we're going to continue with questions. But I would like to give the opportunity to get a break. And before we do that, I would like to share something, information about an event that we're going to have, and to give everyone the opportunity, those who have been received the training, about what, so that you can actually use what you have learned. And it's called in Spanish, Friends and Compadres. And it's going to be here in Sacramento at August 19th. We're going to give you the opportunity to use everything that you have learned. And if you are already vaccinated, you can bring friends to actually come and get vaccinated. And you'll be able to actually have this dialogue, these conversations with them between now and that event. You'll have the opportunity to share the information we've learned today. And the event will be from 4 to 7 p.m. For those who would like to participate. I will share the link so that you can actually see it during the break. And if you're interested, take advantage of this opportunity about using everything that you have learned today. Okay, so now we're going to give ourselves a break and we'll return at 3:20. Right now, if you have questions, please continue writing them in the Q&A. Okay, thank you very much.
Hola, gracias a todos por estar aquí. Ahora vamos a continuar un poco con las preguntas. Vamos a ver el doctor Bermúdez, si está por ahí. A ver, creo que todavía anda en su break el doctor Bermúdez.
Vamos a esperar.
We're going to wait for Dr. Bermudez, and I'm going to give you some information in the meantime. After the doctor comes, we're going to we're only going to have 10 minutes to respond for him to answer questions. We know that you have a lot of questions, and my uh, Vanessa, my colleague, she's going to share a link so that if where you're going to answer questions to see if you want to be a vaccine influencer or a vaccine ambassador, and you can fill out the information to your information to share with us. And remember that the training for vaccine ambassadors, you can also ask questions. So it would be very interesting, and it's important for you to register to actually to become a vaccine ambassador. Thank you, doctor, for being with us today. Thank you to all of you who are here. Okay, so please ask the questions what the doctor is here. And as I actually mentioned, we're only going to have 10 more minutes to ask questions. We know that there are a lot of questions, and I was sharing that there's going to be another training where there also we have the opportunity to ask questions. So we have a question here: who determines who gets the vaccine, or the age, or what age they should get the vaccine? Well, obviously, vaccines are recommended for everyone, and we are recommending vaccination to people who have not been vaccinated yet. We have three vaccines: Pfizer, and that's already been approved for 12-year-olds and up, even to for very old people. Johnson and Johnson also. So we're also right now we're doing actually trials for 6-month-old babies to 12 months, and also from 6 months to 18-year-old Johnson and Johnson and Moderna. But those vaccines are probably not going to be available for them until the end of this year. So to everyone who has not been vaccinated is actually qualifies. And if there is a problem and they have serious side effects or they have conditions, they should ask their doctors. Thank you, doctor. The next question: is it true that people who got vaccinated, the Johnson and Johnson vaccine, would they need a second dose? That's a very good question. But yeah, right now the CDC and the FDA, at the end of this month, they're gathering a lot of all the information from everyone who got vaccinated to see what is the probability of needing a third dose or a booster. And up to now, that's not recommended, but maybe at the but they will have the information, because right now what we know is that if they're vaccinated with those three vaccines, it's very good to get protection so that they don't end up in the hospital and to avoid serious illness with those three vaccines. I want to remind our participants that my colleague Vanessa, she has shared a questionnaire. Please fill it out. It's very important. The next question, doctor, says it's actually similar to the previous one. If a booster is going to be necessary for people who are vaccinated. We're actually monitoring that. It's possible, but I know that somebody already asked a question about that. It's possible that the longer we wait, this virus keeps multiplying, and it may not just be alpha, beta, omega, because this is a virus. Think that this is a virus that actually replicates and millions of times in somebody's in a person's body, and they can mutate into another virus that could be resistant to vaccination. That's what we recommend that people get vaccinated so we can stop this pandemic. Thank you, doctor. We have a very interesting question, and thank you for all your questions. And it says, how true is it true that the vaccines can actually cause encephalitis? And they said that they saw this in a Kaiser post. I haven't seen that type of information, but as with any vaccine, we are studying all of the side effects, and we know that certain vaccine, like the flu vaccine, that is similar, like Johnson and Johnson, it can cause certain reactions in certain people, but we have not actually seen that information that these vaccines produce encephalitis, especially Pfizer or Moderna. I have not heard anything about that. But remember, we are vaccinating in the United States. How many people in California? Adriana said that it was 44 million of vaccines, and that's a lot of vaccines. So maybe that reaction was just a coincidence, but all of that has to be researched. The next question is also very interesting. How true is it that vaccines can cause oh, I'm sorry, that's the one that you have just answered. The other question says, is there an antibiotic that we can take to avoid COVID-19? But remember, antibiotics are for bacteria, right? But this is a virus. So there's no antibiotic that one can take. There's no antivirus that one can antiviral that one can take, because there's some medications that actually can lower the spread of the virus, but we can give medications to maybe avoid to prevent the inflammation, like asteroids, because when one catches the virus, there's a fight between the virus and the antibodies, and that sometimes causes. Uh, so that's why sometimes the medications are used to prevent inflammation. But antibiotics don't work against virus. Antivirals, they don't work. That's why there's no treatment. It's like a cold. So I'm going to actually ask you the question. What is the treatment for the cold? There isn't one. But because there's no treatment, that's why we have to get vaccinated to avoid catching the virus. That's the treatment, that it's prevention before one gets the infection. We have another question, and it says, if a pregnant woman was vaccinated during the pregnancy, so the baby is also getting the benefits of the vaccine, or actually, or she should be vaccinated again. But what we're finding out is the antibodies. It's difficult for them to go from the placenta to the embryo, but with breastfeeding, that's how the antibiotics go from the mother to the baby. That's what we're recommending, is that when they give birth, to breastfeed, because the mother's antibodies are going to benefit the baby. Very good questions that the participants are asking. The next question, if, as you mentioned, these vaccines have been authorized, and if they have been around for such a long time, why haven't they been approved by the FDA? We talked a little bit about that because we said that it takes time to actually to really research the vaccines. And we started actually vaccinating people in October, so it hasn't even been a year. So it takes time. That's why the FDA and the CDC, they have not given the approval because they need to gather all of the information of that 1 year. Uh, Right now, they're only being authorized, but we are certain that they will be approved because the people who are vaccinated, they don't end up in the hospital and they don't die. So they're very good vaccines. Thank you, doctor. The next question says, why are we being, why are they forcing us to wear to wear the masks in public? Well, we're human beings, but you know, but most people actually get upset about wearing masks. Yes, doctor, because sometimes we cannot breathe well, but I think it's uncomfortable to wear the mask. But the reason why I protect myself, and even when I see patients, because I'm worried about giving them an infection. You see, that's what worries me the most. I protect myself because when I go home, even if my wife is vaccinated, my kids are I can still give the virus to them. But because we're human, sometimes we forget things. So, and sometimes white people, they forget wearing the masks. But the most important thing is it will be good if we're all vaccinated, and maybe we won't need to wear that mask. Very good questions that they're asking us. This is another one. How can you say that this vaccine has been studied for 20 years if this is a new vaccine? I think I got confused with the response. I was saying that the technology, the messenger RNA technology has been around for 20 years, that the technology that we are using to produce the vaccine it's been around for 20 years because we've used it for other viruses like Ebola, and we're also using this technology for cancer, certain types of cancer. So this isn't really anything new, but it's new as a vaccine because the virus has been around maybe for a year and a half, 2 years. So we're using the technology that is a 20-year-old technology to produce the messenger RNA vaccine. Thank you, doctor. That there, oh, we already answered the one about antibiotics. Oh, they were also asking me after, so if you get the vaccine, you catch the virus, how long after you catch the virus and 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 the symptoms go away, we recommend to get the next dose. My recommendation is 2 weeks after the symptoms go away. So let's say the symptoms go away 2 weeks later, then you can get the vaccine. Yes, you had mentioned that. There's another question. It isn't a question. It's actually a commentary. It says we should actually we should force people to get the vaccine. What is your opinion, doctor? What? Excuse me. What was it? Yeah, somebody they're saying that actually they should force people to get the vaccine. What is your opinion about that? My opinion really is we're beings, and this is my body and it's my temple. And if I don't want to get the vaccine, eh, uh, I have that choice because there are people who are very religious, and those people don't want to get the vaccine. So there are also sometimes people who are going through chemotherapy or different treatments that maybe does affect their immune system, so they can't be forced. But so we're trying to be sensitive, and we are actually including diversity and equity, because what we want is just that those people who don't want the vaccine, they just don't want it. We can't really force them. But that's my opinion. It says, what is the recommendation for those people who don't believe that COVID-19 is real? That's just a comment. But I want to tell you the truth. Yeah, there's people who say that, and they make me laugh because, but I would recommend it because I'm saying put a mask on and go to the hospital and look at all those people in ventilators. What happens is that a lot of people they they maybe they don't listen, they don't watch the news, they don't know what's happening. Maybe they are very introverted and they really don't realize what's going on. And sometimes maybe they think that the government did this, or that the government is the one who's using the politicians, and they are causing that kind of concerns, and that's actually affecting us as doctors, because we know what the medicine says, the science says, and it says that it is a pandemic, not just here in the United States. When's the last time that you went to Europe, to uh, France, to Spain, to Israel? They all have problems because this is worldwide. And when we see that when we see, haven't you seen when the people actually are and they're when they actually died, and it's something that's real. That they're dead people, and as a doctor, I'm here trying to give people advice, and I'm actually giving diagnosis and treating people with this virus, so it's true. But unfortunately, there are people who don't believe. Oh, there's some that you have already responded. And it says, what safety measures you recommend an organization implements for the people who come to get a service? When we started with the pandemic, all of us here, we started closing certain certain sites, and we had like 8 doors for people to come in, but we closed the entrances doors, because we have two entrances. So the question is, the questions to ask them is, do you have a fever? Do you have a cough? Do you feel bad? And we will take their temperature. That's what we're doing, and we give everyone a mask. But now that has actually evolved, and right now we're not using that kind of that type of discretion. We're just telling the patients, don't come if you're sick, wear the mask, because because most of us who work here are already vaccinated, but everybody in their businesses, they have to follow the CDC rules. Everybody has to wear a mask at work. Thank you, doctor. We're going to, we had mentioned we were only going to have 10 minutes for questions and answers. We have run out of time, but as I mentioned, we're going to have more trainings. And what I recommend is that you register so that we can all actually get more information, and so we can become vaccine influencers, vaccine ambassadors for our safety, and for our loved ones, and for our communities. The questionnaire is in the chat, and now, but we're going to continue with the presentation. Thank you to everyone. Thank you, doctor. Thank you, Maria, for your help with very good questions. Remember, for those who if we didn't have the chance to respond to your questions, please fill out the form in the chat, and you'll have the opportunity to ask your questions, and and we and we can actually give you the answer. So now that we have gone through this training, we need to know a little more about what resources and what kind of resources are there for our communities. And these are actually resources, so information about the vaccines in Sacramento County. And this is the link to the county, Sacramento County website. And we also have a link that is a vaccine finder where you can find vaccine. It's very similar to My Turn, and it helps you find, like if you live in a specific zip code, it can help you find a place where you can get the vaccine. And you can about what's happening every week about the vaccinations. We also we have Kaiser Permanente's website, kp.org, and there's information about the symptoms, about the variants. So you can take a picture of this with your phones, so you can have this information available. And if you would like to have this information, oh, please also include that in the form, in the questionnaire. So what are the next steps? We're going to, this presentation is going to be available, and there are also resources that are available. We're also going to have more trainings, follow-up trainings, so that you can continue. And also, you only have to click on the link, and you can find the information that you need. And oh, you will also be able to see the slides and information and resources for the future vaccine ambassadors and for everybody. Okay, well, thank you very much again to the county, public safety, Sacramento. I would like to also thank Dr. Bermudez, Mike, because they work for the Sacramento County and Public Health, Alana Johnson, Vanessa, to our also our sponsors, Kaiser, the La Familia Counseling Center, all of the collaborators that made this event possible. Thank you very much to all. And if you have more questions, please remember to fill out remember to click on the link for the questionnaire, the form. And we also recommend that you take a picture with your phone of this information so that you can have it available. And I believe that, oh, these are the t-shirts that we're actually going to get, that everyone who actually fills out the form, the questionnaire, will get one of these. And they're going to be in English and in Spanish. So get back to what you love. Well, thank you very much, everyone. Thank you for being here. Have a good rest of your afternoon. And we hope to continue working together with you to empower and educate our communities. Thank you very much.